If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, is yoga really helpful in curing diabetes? Answer by Alina. Diabetes is the leading cause of death in the world. Many people, including the old and the young ones, have diabetes and are suffering from its complications, due to which diabetes is called as the mother of all diseases. Diabetes affects all over the body. Even with dietary control, medicines and insulin injections, people have high glucose levels in the body and wonder what they can do about it. But yoga is a very popular form of exercise which comes with unique benefits. There are so many health issues that can get cured and controlled by practicing yoga, and diabetes is one of them. Regular yoga practice will not only control the glucose levels in the blood but also control the complications that can occur to your body due to diabetes. The following are the benefits of yoga for diabetes patients. Where other treatments fail to cure diabetes, the following are some of the best yoga poses for diabetes. Mandukasana, frog pose. This yoga asana or pose requires the patient to start by sitting in Vajrasana and thus exert pressure on the pancreas. Mandukasana is rather an intense pose, and care should be taken when learning this to ensure that you are doing it correctly to avoid any injury. It is a great stretch for the inner thighs and hips and is one of the excellent yoga poses for diabetes patient, as it stimulates proper functioning of the beta cells. Yoga Mudrasana, the symbol of yoga. The yoga asana is done while sitting in Padmasana, thus exerting pressure on the pancreas and stomach. The patient has to sit up with the legs crossed, the fists clenched and placed on the sides just below the navel. The patient has to bend forward as low as possible and push the tightly clenched fists against the abdomen region while exhaling. If possible, then the pose should be retained for at least 3 minutes. But if you find it difficult, then start with 30 seconds to 1 minute and then gradually increase the time. This yoga posture also assists the nervous system. Paschimottanasana, forward seated bending posture. In this yoga posture, the patient has to sit on a mat with the legs stretched in front. Then the patient has to take in a deep breath while seated and then bend forward from the hips, exhaling while reaching for the toes. Hold the pose for 2 to 3 breaths and then return to the original sitting position. This posture helps to improve the functionality of the pancreas, kidneys and the liver. Shalabhasana, locust posture. This yoga pose is combined with other yogic postures. A posture helps to tone up the pancreas and liver and improves digestion. It also helps to combat acidity. Urdhva Matsyendrasana, spine twist pose. Even though this yoga pose is a bit difficult, it is still an excellent way to recover the pancreas. It provides lateral rotations of the spine to improve the functioning of the digestive system. Also, this posture helps to strengthen the spinal nerves. Kapalabhati, pranayama. This yoga pose mainly involves strong breathing exercises that help to get rid of blockages present in the arteries and also release the mucus. Pranayama should be practiced by the patient for at least 30 minutes each day. When one controls breathing, the lungs act like a pump which exerts pressure and thus helps to get rid of body toxins. Shavasana, the corpse pose. This yoga pose is usually practiced at the end of the yoga session and is a state of total relaxation. The patient should first lay on his/her back with the eyes closed, legs slightly spreading, the feet dropping to the sides. The arms should rest on the sides as the patient focuses on and breathing for 2 to 3 minutes. This yoga posture helps to relax the body muscles that have worked during practicing the other yoga postures. Thus, these yoga poses for diabetes can prove to be effective in managing this chronic illness and help to live a healthy yogic lifestyle. Answer by Ebenezer Daniel. Yes, yoga really helpful in curing diabetes, and to know more information about yoga poses for diabetes, visit this article. How can yoga help fight diabetes? Regular yoga practice can reduce the level of blood sugar, lower blood pressure, maintain weight, reduce symptoms and lower the progress of diabetes, as well as decrease severe complications in the future. Let's see how. Like all diseases for life, stress is one of the most important reasons for diabetes. It increases the secretion of glucagon hormones in the body, responsible for the increase of blood glucose levels. The constant practice of asanas, body positions, pranayamas, breathing exercises, and a few minutes of meditation can help reduce stress on the mind and body. This together reduces glucagons and can help improve the action of insulin. The practice of yoga is also proven to reduce weight as well as control weight gain, which is particularly important to control diabetes. Greetings to the sun, and Kapalbhati pranayamas are one of the best ways to lose weight. Diabetes can also get worse with high blood pressure or hypertension. Yoga asanas, such as Kadabra position, bridge position, child's position and Nidra yoga are all useful for controlling hypertension too. Other yoga positions that are useful in case of diabetes include Vitrasana, kneeling position sail, plow position, spinning of the lying body, position of the bow, bend two legs to the front, and the middle twist of the sitting column. Pranayama Nadi Shodhana is good for diabetics. It helps to release stress and eliminate toxins from the body. Another excellent technique to combat diabetes is the unique breathing technique, Sudarshan Kriya, designed by Sri Ravi Shankar. It has helped many people with diabetes around the world to reduce glucose levels and control their disease by preventing it from becoming serious. You can learn the technique in the Happiness Program course, From the Art of Living. A few minutes of meditation regularly also act as an excellent stress eliminator for the body and mind. While the main cause of diabetes is stress, the health condition is aggravated by the stress of having it. It has also been observed that most diabetics lose self-confidence and end up surrendering to the disease. This is when meditation can help, re-establishing your levels of confidence so that you recover strength to fight the problem and live better. Looking for sweets is a common act in those who suffer from diabetes. Regular meditation practice can help you stop doing this for longer periods. Description of some of the asanas. Posture of the Cobra, Bhujangasana. Lie on your abdomen, your forehead on the floor, your hands under your shoulders, your palms on the floor and your elbows glued to your ribs, your feet together facing up, your heels touching and pressing your pelvis and belly button resting firmly on the floor. Inhale and keep the hands and elbows on the floor, looking up, and gently arching the spine. Raise the chest upwards. Relax the shoulders and focus on the flexion of the upper part. Hold. Lift the elbows to the floor a bit, but keeping the middle slope and elbows close to the body. Relax the shoulders and focus on the flexion of the upper part. Hold. Exhaling. Lower the chest and forehead to the ground. Relax. Repeat the posture, this time straightening the elbows until the end, keeping them close to the body. Lift your chin up. Hold. Relax and rest. Benefits. Rejuvenates the spine, brings greater flexibility to the upper back, tones and massages the muscles of the back and abdominal organs, expands the chest area. Posture of the arch, Dhanurasana. Lie on your abdomen, feet together, and the front on the floor. Bend your legs to your buttocks and hold your feet with your hands. Inhale. Lift your head, chest and knees. Focus on the shoulder extension, joining the knees and lifting them higher. Straighten the elbows by moving the hands away from the feet and lift the chin. Hold. Exhaling. Gently lower. Press the feet down on the buttocks to stretch the quadriceps. Relax. Benefits. Improves flexibility and strengthens the back and spine. Strengthens abdominal muscles and massages and tones of all internal organs. Improves breathing. Answer by Russell Craver. Insulin causes the release of GLUT4 from within the cell to transport glucose across the membrane. Exercise also releases GLUT4, just not in the same quantity. Stretching has also been shown to cause its release, but less than exercise. Yoga won't cure type 1, but it can help control blood sugars, especially if it's vigorous in nature, which is sort of the opposite of many yoga philosophies. If you're a type 2 going from a couch potato lifestyle to doing yoga 4x per week, it will make a huge difference in your body's sensitivity to its own insulin, and may even seem to cure it.